Constituents in my riding have been writing to my office for weeks why their parents or grandparents cannot access vaccines, asking why Scarborough is being left behind. When vaccine registrations and pre-registrations for seniors over 80 and community health workers were open across the province, in many parts of the province, in Scarborough, people were left in the dark and had no option to book for a vaccine because the portal in our region was not open yet. People are being told that the vaccine rollout actually took place. Pharmacies are open, Raxol's open, they ran out, portals closed, and then we're hearing from word of mouth that other places like Costco has it open last night, this morning they're closed, just all over confusion. People are deeply frustrated by the confusing nature of this government's vaccine rollout and, frankly, Speaker, the sheer incompetence of this government. So my question is, what is the plan for the hard-hit communities like Scarborough, and when can seniors in my riding and the rest of Scarborough, frankly, because they have 4 ridings from the government side, can get vaccines? And why is this government turning a blind eye on my community of Scarborough Southwest and, frankly, all the ridings in Scarborough, Mr. Speaker?
There is one plan for the vaccination of all of the people of Ontario. It is being distributed through 34 public health units in their own way because they know the geography, they know the people that live in their ridings. So what happens in Toronto and the best way to do vaccinations is going to be different than in Thunder Bay or other parts of the province. However, I can advise the member, through you, Mr. Speaker, that I visited a mass vaccination site in Scarborough the other day at Centennial College. It's working very, very well. They are able to process several thousand people there. It was quite busy, but it was moving very smoothly. People there don't seem to have a problem knowing where to go. They understand it very well. The system is working the way that it was intended to.
Mr. Speaker, I want to thank all the healthcare workers, all the teams that are going out and vaccinating in Centennial that the minister is talking about, and it started this week. That is the unfortunate part, that it started this week. When York, Peel, other regions were getting it, Scarborough did not, despite being ground zero for this province when it came to COVID. Over 20% of all COVID-19 cases in this province are in Scarborough, and yet the amount of vaccines that Scarborough has received is nowhere near equitable amount to that statistic. We have learned from Scarborough Health Network that they currently have 10,000 dosage of vaccines, despite having the capacity to administer 35,000 of dosage. Scarborough Health Network has one of the highest COVID inpatient numbers for every 100 COVID-positive cases. Our SHN will have 5 admitted to the hospital. And I'm once again asking, how can this government look at the statistics, look at the reality, and still continue to overlook the critical need for an equitable vaccine distribution plan? Can this government commit to an equitable vaccine rollout strategy for communities like ours?
The answer to that is yes. We do have one plan. We do have a plan that's rolling out. We are dependent on receiving vaccines from the federal government. There was a shortage of vaccines, as everyone will remember, in February. However, they are starting to come in larger quantities now, and they are being equitably distributed across the province based on population and also based on those areas that are at higher risk. There are a number of areas that are at higher risk where there are more hospitalizations, more COVID cases, and unfortunately more deaths. Those areas will receive more, and we anticipate that Scarborough will share in that. But there is absolutely an equitable distribution. Scarborough is receiving its fair share, and we will receive more vaccine supplies coming in very shortly, which will allow us to triple or quadruple the number of vaccines that can be delivered to people every day. But we still have to wait for receipt of those vaccines through the federal government.